Hi, everyone, and thank you for tuning in. We're so excited to bring you this amazing lineup of speakers today and our guests, and a conversation about a really critical question. What does equitable community health look like in the digital age? My name is Ksenia Benefant, and I'm the host of today's conversation. In my day-to-day work, I work with Forum for the Future and collaborate with global teams applying futures and systems thinking and tackling complex challenges. And part of this work includes working with the Future Center, which is a participatory digital platform for tracking trends and signals of change, making sense of what's emerging, and building communities to drive positive change across key sustainability and social challenges. The Future Center has partnered with the Johnson & Johnson Center for Health Worker Innovation on a project which aims to build a shared understanding of how COVID has impacted society and distill learnings about what that means for how we design, build, and run more resilient community health models in the future. We're running a series of dialogues across key questions, 6 key questions, which we feel are fundamental to transforming community care models and thinking differently about health systems more broadly. And you can find more about these inquiries and this project on thefuturecenter.org. So for today's conversation around equitable community health in the digital age, I am very excited to introduce 3 amazing guests, each of whom approaches this question from a different angle through their work. Welcome Debbie and Saachi and Gaurav. So I'm going to let each one of them introduce themselves. So please introduce yourself, tell us a little bit about your work. And each of our guests have been asked to choose an image that represents the health system of the future. So I'm also going to ask each one of you, as you introduce yourselves, to share why you chose that image and what does it represent. And we'll start with Debbie.
Great, thanks. I'm very excited to be here, and thanks for having me on this panel. I'm excited to see what the next little while brings. So I'm Debbie Rogers. I'm the managing director of health.org, and we are a South African nonprofit organization that's been working in technology for health for the past nearly 15 years now. And we are based primarily in Johannesburg in South Africa and Cape Town in South Africa, but we have programs throughout Africa and some global programs with international NGOs. Really at the heart of what we do, we believe that we can use very simple technology, such as SMS, USSD, IP messaging platforms like WhatsApp, to be able to connect citizens, health systems, and health workers to ensure improved health and health outcomes. An example of something like this is the Mom Connect program, which has been supported for many years by J&J and ELMA and various other funders. The program is a program in South Africa that's a nationally scaled mHealth program. It was launched in 2014, and every single mother who goes to a public healthcare clinic in South Africa is able to sign up to this program, where she receives messaging throughout her pregnancy and up until her child is 2 years old. This messaging helps her to care for herself, care for her baby, and creates demand for the right services at the right time to ensure that she's accessing all of her ANC visits, all her immunization schedules, etc. And at the same time, this is not just an outgoing message to her, but it's two-way conversation and engagement, which allows her to be able to ask questions or give feedback on the service that she's received at the clinic through a text-based help desk. At the same time, we're supporting nurses through a Health Worker Connect program, where we're supporting them with resilience content, with clinical training, again, all through simple communication methods, and they can also feed back to a help desk and to the Department of Health. Through this program, not only have we been able to reach 80% of the women giving birth in the public healthcare system over the last 6 years, which totals around 4 million people, but we've also been able to generate critical information for the National Department of Health on the services that women are receiving on the ground, so that they can intervene where necessary and improve the system itself. We've also recently launched a large-scale COVID-19 program. It was launched initially in March 2020 with the South African National Department of Health. The WHO has also taken this service called health.The on, as well as 10 other countries through Africa and Southeast Asia, where we provide critical information and services to over 23 million people worldwide around the COVID-19 pandemic. And I think it's really accelerated a lot of how governments are thinking about using mobile, using digital health to communicate directly to citizens and to health workers. So it's been a bit of a wild ride over the last year or so, a little bit longer now, but I think it's been a critical inflection point for digital health in general, and I'm excited to see what this brings in the future. When I looked at this image initially, what I was wanting to depict is that I believe that the healthcare system of the future is it has a couple of elements in it. Firstly, I think that it empowers patients. And I know that this is a healthcare worker who's using a tablet here, but I believe that patients need to be empowered and citizens need to be empowered on their own health journeys. And we've seen a lot of evidence of that, particularly during COVID-19, where people are hungry for information and are being given up-to-date, relevant information across digital services. I also believe that we need to have an integrated paperless system, and will have an integrated paperless system in the future, which will allow for so much more than just empowering citizens on their own journey. It's going to allow for health systems to become predictive. And really what I hope for the future is that we're never surprised by a pandemic again. We never have to rally like we have in the last year to change the way that our health systems work, implement new systems, implement new vaccines in record time. I hope we never have to pull together like we have in the last year, because I believe that if you have a connected, paperless system which has direct contact with patients and empowers them, you will also be able to have leading indicators for health and not just lagging indicators for health. And I don't just mean not being surprised by a pandemic, as much as that's a nice tagline, but also how can a provider look at a piece of data about a citizen. This citizen has perhaps engaged over a long period of time with some self-service tools, and they've been receiving messaging around caring for themselves. Perhaps they have had a baby, but be able to look at the characteristics of the data on that person and be given a predictive view of what are the specific things that you need to do to help to keep this patient healthy, not to treat the disease, not to treat the unwell patient, but how do we keep people healthy? And I think that if we have a truly paperless, interconnected, empowering system like this, we will be able to have predictive power. We will be able to keep people healthy rather than treating disease. And we won't ever have to come together in the way that we have in the last year during the COVID-19 pandemic. And so to me, that's what this picture meant to me, is that at the moment of care, when somebody is engaging with a healthcare worker, that healthcare worker has all the information that they need at their fingertips to be able to help this person, and that they're not just treating disease, but looking into the future as to how to keep them healthy. And I guess that's what resonated with me in this picture, and just spoke to what I think the future of healthcare and community healthcare is in the digital age.
Thank you, Debbie. Lots to unpack there. I'm excited to start thinking, how do we get to your vision later on? And I'm going to call on Saachi to introduce yourself and share your vision for the future.
Hi, I'm Saachi, and I'm currently a medical student and also the Chief Strategy Officer of Khushi Baby. And Khushi Baby is a technology nonprofit startup based in India. Our initial focus was reproductive and child health in Rajasthan, but we are expanding to other primary care verticals, including COVID-19. And what we do is we create digital tools for community health workers, for patients, and for policymakers to stay connected and to ensure that there is more accountability, access, as well as awareness in last mile settings. So we work in very rural areas in India. And in terms of my vision for the future and the photo that I chose, we can maybe pull that up. I can continue. So essentially, like we're trying to empower the community health worker by giving them mobile health tools. And right now, everything in India is functioning on paper. So the public health system, all the way to the end, is a community health worker writing, and she has like 11 paper log books. She writes down all that information. Then at the end of the month, she summarizes it. She goes to the primary health center. Then you have a data entry operator who puts that in. And this whole process just doesn't have the right accountability to ensure that the data that's being entered is of extreme value, and that we're trying to create value in the data that we are collecting. And this data is not actionable either, because it comes in so late, and it comes in a format which doesn't allow policymakers or the community health workers themselves or doctors to really make use of it. So similar to what Debbie was talking about, we also have like a dialect specific automated voice calls and messages that end up going back to the family to ensure that they come to the health camps, they finish their follow-ups, there's like awareness information. So we're just trying to ensure that everyone is included. So this photo is actually a photo of the first IT-enabled clinic that we helped create with the government of Rajasthan, along with other partners, and this is the first one that is not functioning on paper. But just as this nurse is using a mobile health tool here, we have empowered community health workers who are ASHA workers, who are from the local village themselves. So they're I would say that most of them are entering the digital world for the first time, and we're trying to digitally, clinically, and financially empower them. And right now, there are 800,000 ASHA workers across India. There's a huge scope for these community health workers to play a massive role in actually ensuring that people in these last mile settings get the appropriate primary care, preventative care measures that are required to prevent things like maternal and child mortality. So for us in India, I think we're at a different stage than other countries. And I think it's important to point out that across the globe, everybody's at a different stage of what is the future. And what we envision in India is that these community health workers will be digitally empowered. The environment that they are functioning in will also catch up to that. So the connectivity, the infrastructure, it's not useful for them to have these mobile health tools if they don't have basic screening tools as well in these areas. So everything has to have a holistic sort of progress to make things actually work the way we imagine. So I think for us, I think just introducing this whole 80% of India, which is rural, into the digital age will have huge implications for the overall healthcare.
Thank you for sharing. Yeah, it's really interesting. And especially later on, I also want to pick up on the accountability piece that you're talking about, because I think it's really critical in having the value to the data. And Gaurav, I'd love for you to introduce yourself and share your vision for the future.
Sure. Thank you. Nice to meet everyone. So my name is Gaurav. I run a social enterprise based out of India called Dharma Life. What we do is we have a network of women entrepreneurs at the village level who basically work on various sustainable development goals, including preventive healthcare access. The network is spread across 14 states in India and covers 50,000 villages. We have 17,000 people, mostly women. I think 12,500 are women. What we do normally is we work on 4 cause areas. One is around energy access and climate action. The second one is around health and well-being, largely focused on preventive care. The third is around gender, and the fourth is around digital and financial empowerment. We have reached through our programs about 13 million people so far across India, and we are, on the healthcare side, we've been focusing on preventive care for kind of diseases which could have been prevented. So for example, it's focused around reducing air pollution. So and respiratory diseases, it's focused around hygiene, which is both hand wash hygiene and menstrual hygiene. And also now it's been focused around family planning as well. So these are the areas we work on. We work in support of the health worker at the village level. So entrepreneurs supporting them on various programs, especially now in the COVID-19 pandemic, though we've had to, that role has expanded significantly. So where in the past we were working on behavior change toward and prevention of these diseases, now it's become kind of emergency response and around various healthcare needs, where we connect and use our network and platforms to connect people to critical care, to emergency and critical care, to also kind of mental health care as well, to some extent that started. So we, in the pandemic, introduced a digital health visit program where we used our entrepreneurs to cover, kind of, first it was focused on COVID prevention behaviors, behavior change, but then that was in the first wave. The second wave was these health visits were introduced to actually speak to their network and check what is needed, and then there was a classification algorithm which we'd built to get people connected to either within the COVID task forces at the village level to the respective care, in some cases also direct delivery of the essential goods in terms of from a medical perspective as well. So that's been kind of what we've been doing, and my vision for, I think, the future healthcare system, I think I picked this image because I felt that this is actually very close to what we're doing right now. So we have been connecting, village village members to such a form of kind of health consultation, because that's all we could do in this. Apart from other things, that was one of the things which was very required. So we've done digital consultations in this form, and obviously I think it's slightly misrepresentative because obviously you won't have an iPad at the village level, but I think the essence is kind of the same. So it would be probably a smartphone with a not a big tablet, but I thought this would be the right image to depict this, and it's very close to what we've been doing by connecting doctors directly to patients, and then helping solve whatever needs are coming out of that consultation. And so I think that applies both to kind of physical health and mental health. In terms of my kind of vision for the future, I've been working with the J&J Trust of a foundation for some time around asset-based health approaches, and I think we wrote a paper at some point with an experiment as well. So I think my vision for the future here would be to have access, but also to critical and emergency care with technology-enabled programs like these for all. But obviously that goes also beyond the kind of tertiary care, or kind of reactive healthcare solutions for emergencies or treatment, to preventive approaches. So building up resilience on the health side, building up kind of platforms to drive positive health behaviors, I think has been one of my focus areas. And I do believe that a balance needs to be struck, especially in these settings which is quite often not the case. I think it's largely focused on emergency care, although there are programs the government and Indian government in this case, or others, are kind of pursuing. I do think there's still a lot of room to reshape and balance the system towards asset-based approaches, as well as also the whole ecosystem around this, from insurance to treatment, payment models, etc., which are also kind of essential importance to readdress. Otherwise, I think we see this obviously very often. Now, in this case, during the pandemic, how do you? It cannot obviously all be a model of free healthcare access, but in the emergency, I think there still needs to be a balanced model which has to be found here. And I think that's the other focus area, I think, where I believe a new healthcare system will have to address the balance, the payment models, all the ecosystem around, and the technology. And also, finally, the last point I would make on the healthcare system, one thing we have struggled with is that while there's now a plethora of digital solutions, it's actually very risky to implement them for us. I mean, because again, we are an additional provider to supporting the government systems. And I think India is probably much more regulated than, for example, a lot of examples I've seen in Africa. So that's still, there's better protection that way from a regulation perspective, but still that doesn't leave, I think technology governance remains an issue, or at least an open topic. I mean, right now it's obviously you get a lot of relaxations at the moment during the pandemic because everything has to be done somehow. But I think the issue is obviously how do you build a governance system which addresses the risks of technology approaches as well? While I think they're important and essential, these things have to be taken into account. Let me pause here. Thank you.
Yeah, thank you so much for that. Definitely so much to talk about in terms of the ecosystem and the context. What is the context? What are some of the structures and mechanisms that need to be in place in order to get us to the desired future? And you mentioned some of the things around governance models and business models. So we'll be picking that up in our conversation and unpacking that. So thank you all of you for these introductions. And before we kick off into the conversation, I just want to cover off a few logistical points about how we're going to run things today. So for those of you who have already tuned into the first two conversations, this will be a refresher. So I would like to introduce the 3 Horizons framework, because this is the framework we'll be using to structure today's conversation. It's a framework for structured thinking about the future and about transformation. And as the name suggests, the 3 horizons are playing out at the same time today, but each of them contains some seeds of the future. So the x-axis tracks time and the y-axis tracks prevalence. The first horizon is the status quo. It describes the current context and conditions, working assumptions, and the dominant paradigm. And so not all of the ideas, practices, and concepts on the first horizon are fit for the future, which is why you see that the line curve goes down as the time goes on. So the first horizon is what's dominant today, but it's also in decline across a longer term period. And the third horizon describes the future that we want. So right now we're seeing some seeds of the future, as they're called. They're present and visible today. And we often describe these as new trends or emerging innovations. So these could be also seen as weak signals of the future, but as they grow and become mainstream, they will come to form a new paradigm. And then there's the second horizon, which perhaps could be one of the more interesting ones, because this is the space in between. This is the space for disruptive innovation, of new ways of doing and being. It's a space between current state and desired future state. And the innovations that occur in this horizon could either help us shift us to our future state, or they can help to reinforce the current state. So there's actually a difference between these different innovations. And that's something that's really key to be unpacking and exploring. The second thing I'd like to mention is the Miro board, which you're seeing up on the screen. So Miro boards are kind of like whiteboards, and they're used to capture insights. They're great visual tools and great for running workshops. So we're using these boards for all of these conversations. All of these will be available online, and the audience, you as the audience, are welcomed to come in and add comments and share your thoughts on our discussion boards. This is also a way where we'll be using to capture the conversations and then start spotting patterns that we're seeing across all of the different conversations that we're having. And at the end of this, we'll be sharing out all of the different patterns and key insights that we're seeing. So this is also for sharing, for capturing insights, and the participatory tools for ideas exchange. So with that being said, let's jump right into the first horizon. So I was mentioning this is the present status quo. This is the business as usual of today. And as we think about equitable community health in the digital age, and Debbie, you alluded to this, that right now we've been seeing a key inflection point with digital age, because digital adoption has really taken a quantum leap at individual, organizational, and industry levels, especially in the last couple of years during the pandemic. And we heard a quote from Microsoft, who saw 2 years worth of digital transformation in just 2 months. More and more people are moving toward online channels, and companies and industries are responding in return. And the adoption of digital tools and services are years and years ahead of where they were. So I want to pick up with you from the healthcare system perspective and really go into what are you seeing right now in the healthcare system? What is the dominant way of doing things? What does that look like, the digital transformation in the healthcare system?
Yeah, thanks. Look, I think I think Saachi mentioned that the dominant way is paper. And I think that's true across most low and middle income countries throughout the world. There is a dominance of paper. However, to your point of the fact that we've seen massive acceleration just in the past year around these kinds of things. We are seeing, for example, registration for COVID-19 vaccinations being done digitally in many countries. In previous times, just 18 months ago, if we had suggested something like this, everyone would have said, no, it's impossible. We won't be able to reach people. We won't be able to put the system together. How do we decide on who the best supplier is to do it? How do we decide on what the system architecture is? It'll take years. But it hasn't. It's taken a matter of months for many countries to set up systems like this, where you have a central database of people who have registered for vaccination. Those people are also then directed to multiple sites. Stock management and supply and demand are being measured through those systems. And there's direct communication to that person, to that citizen, around when they should or shouldn't go to have a vaccination. And for me, that is an incredible seed of what we're going to see expanding over the next few years. And like you said, a year ago, I would have said that was impossible. It's not. It has happened in many countries, and not just first world or developed countries. That's really how you want to see people being able to engage with a healthcare system. So I think at the moment, because we're at this inflection point, there is still there's been a lot of acceleration around digital healthcare for pandemic management. And that includes sending information to patients. It includes registration. It includes supply chain and demand. It includes being able to make systems more efficient and effective, and digitizing record keeping. Those things are all happening, but they're not necessarily at a disease burden wide or generally in the public healthcare system, but they're certainly being used for pandemic management and can easily, in my opinion, be expanded to the other issues that we're dealing with in public health. But in public health, generally, you are going to find, and certainly in most of the countries that we work in, that there is still a dominance of paper-based records. Where those records are being digitized, it is taking 3, 6, 9 months for that data to be captured and put into a central system. And most analysis of that data then happens thereafter, and gives very weak signals for how the health system should adapt going forward because of the lag of that data. And that, I think, is something that we're seeing across many different countries, and seems to be the experience of some of my colleagues on the call. I would say there's been an increase also in the last year with direct communication to patients around various issues, not just things like pandemic management. I did mention the Mom Connect platform in South Africa. There are a number of other programs like that that are being run. And so although not perhaps the experience of every person in public healthcare in low and middle income countries, I think there is an increase in direct communication to patients through simple mobile technologies as well.
Saachi or Gaurav, would you like to jump in?
Yeah, sure. I completely agree with Debbie on many levels. Even last year, for example, and at the beginning of the pandemic, before the pandemic, if we had even suggested that community health workers who are the village level workers could use mobile technology, we would have received a significant resistance from the government because the education level of the community health worker is up to a high school level, and also they're not really using mobile technology at all. So, but last year we were able to onboard over 60,000 health workers, 30,000 of which were community health workers who use their own mobile phones or their husband's mobile phones or their neighbors' mobile phones, and through a virtual training were able to conduct COVID-19 active surveillance across villages. So that was pretty incredible, and I think it's going to open a lot of doors. I would also like to talk a little bit about the healthcare system in India right now. So the way that it is designed is that all the health verticals, whether you think of reproductive and child health or non-communicable disease or infectious disease, these are all they're all siloed. So the data goes into separate systems at a central level or a state level. And you are not really able to see the overlap of these health conditions when in fact, the people that you're treating might be suffering from multiple and might fall into several verticals. So because the system is designed in that way, I'm not sure if this is stuck. Are you, Debbie, are you
I'm hearing you fine, Saachi. And I agree. And it's not just India, I can tell you that much. Many other countries.
Yeah, I'm sure. I'm just speaking for India because that's what I'm familiar with. But and what happens then is that the people who are innovating in this space are trying to fit their solutions into this overarching system, which in fact is not promoting the efficiencies that we hope to see. So you have community health workers at the last mile who right now have, let's say, 11 paper registers that they're filling different verticals in, but then you have they're given multiple apps to work on. So rather than just one integrated mobile application, which will then feed into a single system. So that requires a huge infrastructure change at a high level. So that's one thing I think that the system, what I'm seeing in the system today, that requires a lot more thought and openness to kind of change at a policy level. And then the second thing is that when you have these technology solutions that are being created for these last mile settings, you also have to make sure that the people who are using them or the human resources are ready for it, and the patients are ready for it. So I agree that it's really important to connect patients to providers and empower the patient. But if the patient is not being educated well, and the patient is being is marginalized and not empowered themselves to even enter the systems that we create, that's a huge problem. So I think it needs to be like a holistic approach where you have multiple people, like multiple disciplines sitting together on a table and deciding what do they think of the future of health and how can all of them contribute to that future.
I love that. I love that you're sort of saying multiple disciplines sitting together at the table, because that's so key. And yeah, and I think part of the digital divide is, there's the education piece, there's the access as well as the education piece. So that's super, critical. And Gaurav, would love to hear your perspective. And I know you're working in the health system and also broader. So what are you seeing in terms of the digital age and current state?
So I think just echoing, I think what Debbie and Saachi said, I think generally offline paper prevalence across, I think I think we see that across still. I think hard to change that. I think we were running one program specifically for managing, I think young married couples, or I think adolescents who are about to be married or get married, and their family planning needs. And I think the key issue with this program was that we had to map every single YMC young married couple in between the age of 15 and 25, 15 and 24. And normally that data should exist at the level of the health worker in the village, and it was a nightmare to be honest to get the data, because you have to cover 100% of them. Now normally that whole process to get that access in the end ended up we had to create our own consumer mapping or beneficiary mapping program, which we then ran digitally through at the village level, and that then allowed us to do this. So just to illustrate the example, where if this would exist, it would have sped up the program by 3 months, but then we couldn't do that because we had to create that data then in the end. And that's usually the case in a lot of these situations. So very manual, very paper-based. If you want to have an impact, then you have to first do the pre-work and plan for that. And that's kind of so echoing what has been said before. The second thing I would say is that the current status quo, there's kind of the whole patient or perspective itself. I would just elaborate on that. I think the willingness or readiness to see a digital consultation as something which is which replaces the physical or augments or supports the physical consultation or preempts it before going for that physical consultation. That readiness kind of varies amongst the different groups we work with significantly. And I think the status quo is that you'll have, a typical, as you would have with solutions, early adopters, you'll have some younger lot usually, or some of the older ones who are very progressive. That all have. So I wouldn't only link it to kind of age, but I think there's different kind of user groups, more personas one would see. And obviously the pandemic has led to the reality that more open persona has increased in number, right? I think that has helped a lot of people, I think, having solutions, including us, to actually have this openness. I think I would say that the status quo is slightly changed. If you asked me this a year ago, I think that would be different an answer or a year and a half ago. So I think that's positive, but there's still a long way to go. And I think it also there's a continuum in terms of type of service. I think some sort of health services are actually beneficial to do digitally. So I think things which require more privacy, things which require more kind of anonymity, right? We're not comfortable talking to your kind of someone as a doctor in the village, right? And doing that digitally, I think that in the current state is that there's a whole area of digital services consultations where this is kind of helpful. So it actually fosters the adoption. That's what we saw, at least. And given that we work on some of these sensitive topics, I think they could be preventive. So the example here is menstrual hygiene. The example is family planning. I think, however, from a perspective of other things like, I didn't see it though in mental health so far, because mental health is first the readiness to even get to a consultation kind of masks this effect, right? Because you first have to be ready to get a mental health counseling session, right? So that's why it's harder. For primary health or kind of GP level services, first level kind of support, I see this changing now, but it's still not replacing the physical consultation. I think that's a huge amount of kind of progress to happen for people to value the digital consultation. And I think that's where we are, at least at the moment. And finally, I think if I look at the providers, I think I looked at the digitization of the processes, the consumer level, and the third one is the readiness of providers to do this digitally. I think there we have also kind of status quo is, right now I have a struggle where we have more demand for the consultations than we can supply So there's the same issue exists at the provider level, where we would, to actually find a qualified or someone, there's no certification for these services. If we want to provide them digitally, so we have to look at that ourselves and find a way to be comfortable, both from a risk protection perspective as well as from a quality of service perspective. So I think that's another issue at the moment, and I hope that changes. But that I would. I think say that the status quo is there's a long way to go, and there's some upstarts and a lot of people who are moving in this direction have moved in the pandemic. But yeah, let's see what happens post normalization, and hopefully that speeds up. I think that's the perspective I would bring in. Thank you.
Mm-hmm. Yeah, thanks so much for that thorough diagnosis of current state, because it seems like the pandemic was a great catalyst and things are moving, but there's all these kinks and issues and challenges that haven't been thought through because things had to be done so quickly right now to deploy services. So really thinking through the governance and business models and how do we get people on the platforms and education piece and then engagement. So all of that are things that need to actually be designed, and bringing those multidisciplinary perspectives are so crucial. So with that, let's go into our future Horizon 3, our future desired state. And I know each of you have shared a little bit already about that future desired state. And I guess if you're thinking about what is the future that we want to bring about, if we had to describe this new health system paradigm, what would be the hallmarks? You can think about, what would be some of the new mental models that are really underpinning our beliefs and values that are enabling the future? What would be some policies, economic models? How would the technology be deployed? So let's really flush out what that potential future vision could look like. Maybe I'll start with Saachi, and maybe build off the work that the mission, Khushi Baby's mission is to build a digital integrated community health platforms. Maybe if you can really unpack that, what would that look like?
Yeah, sure. So yeah, this is our biggest project that we're working towards, but right now we have to fit it in within this siloed system. So we would have to collect all that data into one area and then kind of divide that into the different systems that the government has in place. And what that would look like is that the community health worker and the nurse and then the medical officer, these three people who are focusing on the rural areas, they would have a mobile app which integrates all of the national vertical programs, and those would be linked. So right now the healthcare providers, the doctor, nurse, or community health are not even connected. So for example, when a community health worker refers someone, the doctor doesn't know that the person has been referred. The nurse doesn't know. So we want to make sure that all three of these providers have a list, the same list of who is supposed to receive higher level care, so that they can all take action at that level and ensure that somebody doesn't come, at least we know that they didn't go. So so connecting all of them is very, very important to us. And then also ensuring that at a higher level, imagine if you were able to collect information that there's an infectious disease outbreak, but then there's also like a higher level of pregnant women in that area. At least you can, through GIS mapping, what areas need a higher level of focus. So being able to create those visualizations, because right now they don't have any GIS data because everything's on paper. So that's something that we're going to try to ensure. And we've already started doing it during COVID, where we've been able to show high risk areas, and then policymakers will then hold campaigns and camps and screening camps so that they can identify what is the issue. And then we're also trying to create like supply management. So like, for example, through the app, the community health workers can also say if they are lacking any digital tools, like a BP monitor or any of that. So then at least you can respond immediately. And so that's how we're trying to integrate the system, so that there's just one tool that they have to use. And then I think I think what we're doing, so I'm going to give an example of what's happening right now with COVID. So right now, the current CoWIN platform that the government of India has launched is not designed for people with patients who do not have a high education level. So right now, even if you have to register yourself for a vaccination, each person has to have an OTP, so like a phone number, and they have to, so technically someone else cannot register the patients in the villages for their vaccination. So, and it's also an online app. So basically, what even something so small as like a community health worker having the power to register multiple people for vaccination and then input whether that has been completed, or even so just the registration process is not designed so that a patient who doesn't have any education level can actually register themselves. So we're making sure that all of the solutions we create are taking those patients into account and making it culturally sensitive, where we are designing to, if we have all these community health workers and we aren't empowering them in the correct way, we're trying to make sure that that happens. So so I'll stop there, but that's essentially what we envision for like the rural public health system. And then one more thing is that we want to make sure that every patient is able to hold in their hands their digital health record and share that medical history across different settings with their consent. So even if it's just the essential medical history, and we've created that for offline settings as well, where basically patients have like a card which kind of looks like a credit card, and it has like a near field communication chip, and that stores all their essential medical history. So even patients in these last mile settings have the power to share their history across different settings, and at an urban level where there is connectivity, that could be much more complex and advanced.
I think in a sort of simple way, I think that the future is when no one talks about digital health anymore, when it is just healthcare. And, you know, it's just taken for granted that digital is an essential part of providing good quality healthcare, as is, you know, well-trained, well-supported, resilient staff members and, you know, well-stocked facilities. Just as important is the digital backbone, the ability to look at data, the ability for people to share their medical records, the ability to get predictive analysis on what the high risk for this patient might be. So I think the future of digital health is no digital health, where really it is just seen as a critical part of healthcare. And I do think that is where we're heading. But I hope that I certainly hope I get to see the time when we're no longer called a digital health company, but just a health company. And I think that's really where we want to be heading. I do genuinely believe that having digital as a core part of the infrastructure of a healthcare system, including the elements that Gaurav and Saachi have mentioned, such as digital consultations and the ability to have your own health record that you can share. All of these things are infrastructural needs for healthcare. And just the fact that they have to be digital shouldn't be the focus. And that's what I hope we head towards.
I think just to add, I think aligned with what you said, I think also from perspective, I like your comment, Debbie, on that it should not be digital versus non-digital. It should be the customer experience or the patient experience, which matters the most, but also the experience of the provider, right? I think in a system, if you're looking at it as a holistic system, I would say that it should be both experiences so that you have the best talent giving the, having, or the patients having access to the best possible options and vice versa, kind of having an equitable model for providers to be able to deliver the best kind of quality of care across the groups. And I do think, though, the one thing I would add here, though, is I think we've done this in India well with, again, there's pros and cons of such an approach, but I would add to this vision maybe some metrics around equitable access in terms of, maybe it's like, I think we have this in other domains on education, for example, where there's access to a certain percentage of access has to be given by top providers to the kind of people who can't afford it. I think something like that, I think, would be part of that system. I would just add that to, I think, what both of you said as one other kind of angle, that I think we should have the best kind of, it should not be fully market-based. There should be some social responsibility built into access in this model, right? So I think would just add that, however that can be structured with the usual bells and whistles of these models as well. I think that that's one thing I would add. In terms of digital experience, I think I would add one more thing where the future should have, I do think the UI UX perspective is important. I think I build on that. I think we have had the same issue. COVID example is a great one. Gee, I think we've been doing this. I think tens of thousands of registrations my team has been executing for what you were just saying. Well, technically it's not possible. Practically, is that the only way to get people to understand at the village level, to be able to sign up and then manage them to get there. And I think everything you have to do to get people, kind of vaccinated at the moment, remove vaccine hesitancy, and the app doesn't really help with that process at all. If anything, again, should not be quoting here on record, but I think it's a great effort given the situation, but I think it could be definitely more inclusive. And I think that's what we've been doing, and trying to have assisted vaccination services, basically, not the vaccination itself, but getting people actually to the vaccination and aligning that. So I think that's why I'm saying the UI UX perspective is really important. I think for the future, that I think we are seeing here in kind of the more casual health space, from the tech providers, a more user-centric approach. I think, and the developed world, we're seeing that here extensively. A bit of that for all would be great, I think. And obviously, again, while we still, I think the level of the time it's taking to get our health records on such a system safely, right? On, let's say, an Apple Health Kit safely. I think you can imagine that for the markets we work in, or the thing that I do think that there's a possibility of leapfrogging in the future, because I think there's probably less bureaucracy, less. As long as one has the safeguards in place, I think it would be probably quicker to get to that level. We see that a lot already in other. I think if I just talk about simple blood tests and how efficient it is in India to do this, and how the records are digitized, and you can see this from the private providers, I do think there's hope that I think the BOP, kind of patient, which I'm targeting at least, I think can go much faster in that direction to have that experience. So I think that's a positive. So I think that would be another kind of perspective. But I do think the UI UX has to be, designed for a purpose. I think quite often these solutions we see are not there, right? I think, so examples like voice-based entry, voice-based kind of interaction for people to be inclusive, maybe I think simplification of, I think, language inclusiveness, voice usage, then I think simplicity of the interface design. So these are things we've been focusing on. I do think they're part of this kind of future vision, have to be to have more inclusive, or more people use the solutions. And then lastly, I feel that I think one of the other things I would like to see, and I think would be exciting to see, is this ability to match, right? I think we've seen this now in the pandemic. We ran a helpline, now simple, because again, there were so many different requests. And so the key thing was to classify the query and match it appropriately. I think there's room for such platforms, and we're trying to look at something like that, because I think the whole benefit of this digital or the COVID pandemic has been the universality of access, or democratization of access. So that means we could technically get the best doctor to see that patient. And if that is done through a matching platform, I think that there's huge, the vision here would include some objective, maybe not commercially driven or balanced in a way, platforms to do this matching. I think so these are just micro points. I think I was last, so I think it was adding to both of your points. I think that completes the picture. So.
Yeah, thank you so much. Yeah, feel free to jump in.
Yeah, I just wanted to add one thing. I like that you mentioned bureaucracy, because even during the pandemic, I think like the country rushed to create solutions, and they had to at least make some impact. And it's not that the country is not willing to adapt those solutions to make them inclusive, because even the CoWIN had a grand challenge where they tried to select companies across the country that were working on the gaps that their system had, which was why one of our company was picked for the accountability piece. So I think there is effort towards this, but I think that bureaucracy is quite rigid, and it's very difficult to sort of get those accesses moving forward. There's a bunch of plans made, but it's just that getting that access right now to make it possible is always difficult. So I think even if the processes within the government are accelerated in some way. So even the government works on paper. Like the files move from office to office on paper. So that also probably increases the time duration to even get accesses to launch things, or to even customize and redesign. So having that flexibility will, because technology just becomes more powerful when you give it the freedom to redesign and make iterations again and again. And I think we need to have the freedom to do that.
Thank you for that. And Debbie, did you want to add anything else?
Just a little add. I think, we're always going to be in this situation in the right now where the innovations are pushing ahead of the policy and the status quo. And I'm glad for that, because that's what keeps us moving forward. So I don't think that in the future, there will not still be things that are disruptive, things that are ahead of policy, things that need to be pushed and meet some kind of resistance to being adopted initially. In fact, I hope that stays the same so that we can continue pushing forward. But I do hope that what policy is able to do, and hopefully the COVID-19 pandemic is accelerating some of that. I've certainly seen policy changes happening much faster in countries where we're working at the moment to facilitate the COVID-19 work. If there's that same kind of urgency to ensure that policies make for a more robust system in general for digital health, where it's an enabling policy while still putting the guardrails in place. It is health. We do have to be careful. We do have to be aware of what we're implementing, but make it an enabling environment. I think that's just going to mean that we can accelerate what we're able to do. And I'm hopeful that a lot of what has been learned by many governments, many organizations, many implementing partners in the past year will help to accelerate that policy change, create a more enabling environment, and mean that there will be, just more proliferation of these kinds of engagements that we've seen mentioned here today.
Yeah, this is a perfect segue into going into that second horizon and exploring how do we get there, policy being one of them, but it's really what is the enabling environment, what are the disruptive innovation that need to happen right now to get to our desired future, and how do we get there? I know we've talked about some of these things, such as the UI and UX, the importance of really designing in such a way that makes it really accessible and easy from both on the provider as well as the patient side. What are some of the seeds that you're seeing of the future? Like, where are you seeing some of these policy and design tools that are actually taking place right now, and where the seeds are being planted and they're actually having a change, they're having an impact? And anyone can jump in.
Go, Saachi. I feel like I said the last thing. I need to give you space to talk.
Yeah, I mean, that comes to mind is that there are policies now being created where it's mandatory for patients to have access to their medical information, just so that they can in also a digestible format where they can understand it, and then they can also relay that to other providers. So having that freedom of going to different providers and having the full history for informed care to take place. So that's one thing. And in India, where they're creating like a digital health ID, so that everybody has access to their information, and it can all be held in one place. At the same time, all of this again needs to be inclusive because the majority of the country is in rural areas, and there is a lack of access to technology and bandwidth and things like that. So I'll just mention one point, and then we can kind of, I guess, circulate.
I think one of the big seeds driving innovation at the moment, as much as there's still very big challenges around access and infrastructure, is the growth, the massive growth. The market forces driving the massive growth of the mobile technology infrastructure in countries. The market forces driving down the cost of mobile phones and also the cost of data. So that people can engage. And I think that those three things are definitely creating an enabling environment. Should we be able to accelerate that even more, that will create an even more enabling environment, I believe. I think another big piece is cloud computing and the fact that most countries that we work in have a need for health records to be hosted in country. And yet there are not that many, very flexible, highly reliable cloud-based services in these countries. And so that's certainly a barrier at the moment. But, there is now one in Africa. There is now an AWS cluster. There's now an Azure cluster. It has been for a while in India, AWS. But we're seeing more expansion, more of these kinds of clusters. And that's really important for accelerating our work, certainly. And I think that that's definitely creating an enabling environment. And we can see, if we can see more of these kinds of services set up in more countries, it's going to make it cheaper and faster to deliver technical solutions for health. I think that distributed ledgers is an opportunity for what Saachi was talking about with respect to having your own data, your own health record available to yourself. I hesitate to say AI and blockchain because they sound like buzzwords that everyone just uses for fun. But I do think that distributed health systems, whether that is using blockchain or not, is a massive potential where I am seeing for health records, for people owning their own health records. I do also think that the advances in artificial intelligence are adding a lot to a lot of healthcare systems. The biggest problem still is getting reliable data on which to train these systems. And so if we can, find ways to get more reliable data, work with organizations who care about that and are making sure that it is really reliable data, then there really is a lot that I think AI can do. And I'm seeing some interesting things come out of COVID around predicting outbreaks, around matching, as Gaurav mentioned. So I think that there are lots of those seeds that I'm seeing at the moment. And I think that all of these technologies are going to accelerate our ability to get to that final to that final answer, and not just in a way that doesn't promote equity. I think the market forces around access to data and access to phones and access to mobile signal are going to be the things that are going to help us to make sure that this happens not just in silos, not in an equitable way. And I think the other thing is that there are more, I see more change in the funders in the space being more aware of how to fund tech innovations, how to make them more sustainable, how to think about what's going to make them work, how to make them more equitable. I see a lot of changes there, and I definitely think that's going to accelerate our growth. I see the same with organizations that are developing technology solutions in this space, experimenting with different business models, and thinking more about how you sustain a technical implementation like this. And I think that that's incredibly interesting, and also going to drive. So sorry, now I feel like I'm making it the longest list in the world, but as I was talking, I was getting excited about all the things that I'm seeing in the space at the moment that are really seeds for if these things take off, if these things really accelerate in the way that I think they might, they're going to mean that future vision that we had is going to be here a lot faster, and it's going to be a more equitable vision.
Thank you so much for that, Debbie. And Gaurav, I'd love to pick up the points on the demand side and patient engagement, and what's already happening on that front, and what is the horizon too that needs to happen in order to get us to the future that we want.
So I think if I'll take this question from a preventive care perspective, because I think we've looked at the other lenses. So I think what we see in this pandemic is a huge amount of openness amongst the younger generations to actually use technology for various of these prevention kind of models. So we have run girls focus groups for behavior change on WhatsApp, right? So this is things like that are happening. So I see huge positive kind of uptake, especially for among adolescents and children, as well as young adults, in kind of a lot of the technology on the technology front. Obviously, because of the mega trends of smartphone and adoption data being cheaper, right? Connectivity and data being cheaper. I think India has the lowest, cost of data in the world, and that's obviously fueling all this as well. But so I see that as a very encouraging trend, and I think that continuing will, is creating a spillover for other members of the family. And, I think we see that on the behavior side extensively. And I think that's probably a good, it's on a growth path, which I feel is going to, it's just accelerating. We don't see any slowdown. I think the convenience, factors, barring obviously some issues which are more on cultural and or also the risks where there's been, if there'll be setbacks surely because of some of the misuse of these technologies as well. But I think overarching the trend is positive on technology adoption and usage of services. Similarly, I think the pandemic has forced or has really helped creating a lot of providers as well to fulfill some of this. Although that's, I think, that I think is an encouraging trend. And I think also billing models and nursing models, business models are following suit. I think right now, probably a lot of these models are not sustainable, but I think that's kind of where I think with scale that will happen. So I think probably there's a lot more in the scenario too. There will be, I think, with the funders stepping up, as W said, I think there'll be a lot more experimentation. I think there will be players which crystallize themselves afterwards. I think that's there, but I think so it's encouraging to see that. Finally, I think I don't see yet, and maybe that's because we are struggling through this, and that's a gap in this case, and hopefully that will get picked up. I think basically there's three ways obviously for this to work sustainably. One is government sort of support or kind of funding. Second is the consumer paying, right? Or the third would be kind of a hybrid. But I don't see the financial we're seeing the financial kind of instruments, insurance, the penetration still being very limited. So that's a concern in this case, I think, but I hope that'll follow suit. I think we in terms of, coverage for policies for some of these services, or actually insurance models which work. I'm sure there's work happening, but I've not seen that come to the forefront too much in the pandemic yet. Maybe that'll happen now, I think. So that's what I would add. Thanks.
Yeah, good point. Thank you. So we only have a couple of minutes left, and we've had such a good, rich, fruitful conversation, and definitely you've given all of us a lot to think about. And as we wrap up, I just want to ask you if anyone has any final, or offer you some time to share your final thoughts, and just wrapping up. and maybe the key things that we need to get to the future.
I think I'll just echo what Debbie and Gaurav kind of touched upon. And I think that ensuring accountability is, oh, I'm so sorry. Ensuring accountability is extremely important for the data to be useful. So we are working on solutions that ensure that we can track every input of data through biometrics, or we could, if we could create IoT devices which through Bluetooth can capture health data directly into the mobile application itself, and at a low cost. So being able to create all these solutions at a low cost as well, and ensuring that, what I thought was really interesting that Debbie talked about was the fact that a lot of countries and a lot of states in India do not have the technology infrastructure to handle all these solutions. So Rajasthan, where we work, does, but many of the states that we're entering into don't. So that's also very important to ensure privacy, and that we're ensuring that we're within the government guidelines. And also I'll mention, I think that the most important thing for the future of health systems to sort of take advantage of this digital solutions is education on the patient side. And I think what Gaurav is doing, trying to create behavior change and educating, that needs to be done at a government level as well, at a huge sort of scale, to bring all these people on board, because I find that that's a very big gap that will, if not addressed, could lead to a lot of these systems not being sustainable, not scaling, and potentially failing. So yeah.
I think I'll go next. I think just on my end, that I think we've covered most of the things. Just as a closing comment, I think the balance of all three, providers, government, and user, I think all three, I think we have to, there's kind of pathways we've defined in this discussion or visioning exercise, which I'm sure a lot of people are working on. But I think that it's important that equilibrium kind of, or that system is fully aligned in the path. I think what we're seeing right now is we're seeing different velocity of change across all three, if I may put it as crudely as that. I think it's important that there's some sort of blueprint towards that. I think right now in the open system, this happens in kind of a very kind of market-driven manner, and that's kind of one of my concerns, which I would echo here, because I think, or which I would mention here, because I feel that could lead to, I think, if it's not managed somehow, I think it could lead to a lot of issues and crises. And I think that's the only point I would add here. I think while I'm very optimistic about this change process, I do see these risks. And I think it goes back to the point on governance or accountability, as well as kind of risk management on behalf of governments to manage these the systems appropriately. And I feel that is something which should be highlighted. I think that's my only other point I would add. Thank you.
I think my final thought is just that we can't let the fatigue of having gone through the COVID-19 pandemic stop the acceleration of this work. I think, we saw with the outbreak of Ebola in West Africa that despite that, the world wasn't prepared for COVID-19. So I think we just need to make sure that we're not just so relieved that we've moved past, a pandemic, that we forget all that we've learned. And all of the advances that have been made during this time, and that we ensure that we really capture those, that we learn from them, that we leverage them to create better healthcare systems for all the citizens all over the world, so that, God forbid, if there is another pandemic, or when there is another pandemic, we are more prepared, and we don't look back and say, if only we had leveraged what we'd learned in the previous pandemic. So I think that's just my final note to remember that we've learned so much, we've come so far, we need to take advantage of that and leverage it as much as possible.
Mm-hmm. Yeah, thank you so much for all three of you for bringing such fascinating insights. So for the audience out there, for the next conversation, we'll be exploring mechanics and structures needed to support and elevate community health. So join us next week for that. And you can follow this project. You can share your thoughts on thefuturecenter.org. Thanks again to all of you for joining us.
Thank you.
Thank you.
Everyone.
Thanks.